All right, thanks for starting your weekend with us here at Twin Cities Live. So Kelly Hansen is filling in for Elizabeth, who will be back on Monday.
That's right. Our Thrive with Twin Cities Live series focuses on your health and wellness, and we're taking a few minutes to discuss a topic that impacts so many of us, and that is breast cancer.
Absolutely. In the South Metro, one clinic offers specialty services to those considered high risk. Michele Haehnel is a certified nurse practitioner and certified genetic provider for Minnesota Oncology, and she joins us today along with ways to reduce your risk. How are you? Thanks for joining us.
I'm well. Thanks for having me.
Yeah, this is very important.
This is
right?
a really important conversation, and I have breast cancer in my family on my mother's side, and I always think I'm probably high risk, but I don't even know what that means. What are some ways that when we say high risk, how are we impacted? What does that mean?
So being high risk does come from multiple factors, including some personal health information and then family cancer history. So we use factors, and we have scientific breast cancer risk tools that we use to look at 5-year or lifetime breast cancer risk. Now, we all do have breast cancer risk. Average lifetime risk for women is about 12%.
Wow.
So that's about 1 in 8 women. When we're looking at high risk, we're looking at a lifetime risk over about 20%.
Oh my gosh.
So some of the factors that raise that risk to be elevated would be a strong family history of breast cancer on your maternal or paternal side of the family.
Doesn't matter.
Doesn't matter. We're also looking at whether women have maybe had a past history of a breast biopsy with a certain pathology of atypia. We're also looking at if there's a young breast cancer in the family, so that means under the age of 50 on your maternal or paternal side of the family, that may raise some risk. We also look at personal factors. So women that have dense breast tissue along with a family history of breast cancer most likely is going to be elevating some risk.
Yeah. And one of the things that we saw on there is, and we were talking during the commercial break, men have to pay attention to this too. I mean, I know that it is greatly associated with women getting breast cancer, but men also get breast cancer, maybe not as prevalent, but what is the ratio? You said the 1 in 8 for women. What is it for men?
It's close to about 1 in 800 for men.
So it's very rare.
It is very rare, and it is one of those triggers if you have a family history of a male with breast cancer, that we have a concern about genetic risk, and so that's important to let your provider know.
And that's because of the rarity. That's where the genetics come into play.
Yeah. So you mentioned a lot of the other risk factors that may put you in that high risk factor. What about lifestyle? What other things, we're talking genetics, we're talking maybe the density of the tissue and other things, but what about when someone comes in and they say, well, this is how I eat, and this is what I do, and this is what I do in my free time, and you're like, that could be high risk as well. I know, what are those things look like?
Lifestyle is very important. I mean, there are things that are non-modifiable, and we're talking about family history, but there are things that are modifiable, including maintaining a healthy body weight, being physically active, having good cardiovascular, some strengthening activity a few times a week at least. Important to minimize alcohol consumption, avoiding smoking, a healthy diet.
All these things we should be doing.
Fruits and vegetables,
right?
Good for lots of things in the body,
Right.
but also really important for breast cancer risk too.
Okay, Minnesota Oncology has a special clinic for high-risk patients. What does that mean? What does this clinic offer those patients?
So we have a multidisciplinary breast team. I do meet patients in person initially and do a thorough assessment about your personal health information, your family cancer history. We develop a relationship. We set together what your risk scores are and outline a future planning for breast screening, close monitoring. I see women once or twice yearly for breast exams.
So this is even before they would get a breast cancer diagnosis?
Correct.
Okay.
Correct. The goal of all of this is to understand where your risk is and to be proactive. The women that I'm seeing want to take some control. They've been experienced with breast cancer in their family, and it's emotional, and they want to do what they can to minimize their risk and have close surveillance.
Yeah. Do you need a referral to be part of this high-risk program?
I don't require a referral, but insurances may recommend that. So I always say check with your insurance first. It's a specialized clinic.
Okay.
Yeah, I mean, that is sometimes the frustrating part is that we're not going to go into how the system is all geared, but you feel like, why do I have to go through so many hoops just to figure out if I'm high risk or something like that? And you're looking to be preventative.
Correct.
It might not even be like, oh, this is an emergency situation, I feel a lump or this. I just want to get out in front of this and be proactive, and it still makes you jump through some hoops. So I'm glad that you don't have to have a referral. Now, when it comes to other testing, do you guys do the genetic testing, the DNA testing? testing? Is that all done at the clinic as well?
So I do provide a hereditary cancer risk assessment, and we do talk about risks and benefits of genetic testing. And if someone's interested in doing that, I provide genetic testing at our clinic.
Okay, I think the thing to remember, and because it's in my family, and I do think about it often when I schedule my mammogram, which that's like the first key piece, right? To make sure you have that yearly. But I'm a little scared of what to find out, right? So I'm thinking, do I do the genetic testing? But I think having a program like yours, where maybe I don't need the genetic testing, maybe there are other things that you can rule out with other
there are criteria that would make me raise a red flag for consideration of genetic testing, whether that's appropriate or not. You certainly may be high risk for breast cancer and outside of genetics, and so we still would formulate a plan and look at a screening outline for you and be that support system to you.
Right, but it's just the proactiveness.
Correct.
Taking control before you
Absolutely.
feel out of control.
Correct.
Yep, and knowledge is power.
Yeah.
Thanks so much.
Thank you so much.
Thank
This
you.
is so interesting. All right, well, to connect with the more than 100 cancer care experts at Minnesota Oncology, head to mnoncology.com.